In dogs and cats, the splenic capsule is a thin, smooth, hyperechoic line. The parenchyma is homogeneous and slightly more echogenic than normal liver parenchyma or renal cortex. Splenic veins can be seen crossing the visceral splenic capsule at the hilus of the spleen. The presence of veins crossing the capsule helps to differentiate spleen from liver. In the liver, the hepatic blood vessels remain inside of the capsule. The head of the spleen can be found in the left cranial lateral abdomen. The body and tail of the spleen can be found almost anywhere in the abdomen. Surrounding omental and mesenteric fat is generally hypoechoic. In dogs, the normal spleen can be large or small. Working breeds in particular may have a greatly enlarged but normal spleen. In some dogs, fat may be stored as hyperechoic nodules inside of the parenchyma. Biopsy is needed to confirm these lesions as fat. Hyperechoic areas along the splenic veins at the splenic capsule are normal invaginations of the splenic capsule. In a short-axis view, the normal spleen in a cat is always small and triangular in appearance. In many cases, you may need to decrease depth to help locate and recognize the spleen. The capsule is a thin, smooth, hyperechoic line. Parenchyma is homogeneous and slightly more echogenic than normal liver parenchyma or normal renal cortex. Surrounding omental and mesenteric fat is generally hypoechoic. The normal cat spleen can often be seen in a single transducer path from head to tail. A normal cat spleen is never enlarged. In the cat, the spleen does not act as a reservoir for blood, as it does in the dog. Occasional splenic veins can be seen crossing the visceral surface of the splenic capsule. The normal cat spleen should not be thicker than 10 millimeters. There are no other common measurements of the normal spleen of a dog or cat. Any splenic lesions found by ultrasound should be measured by length and width and described by location in the spleen for future reference. The lesion in this case is in the head of the spleen, and the ribs make it difficult to get a good image. The image of the measurements should be labeled and printed or stored in the archive system of the ultrasound machine for future review and comparison.